When we think about heart problems, our minds often jump to the dramatic scenes we see in movies. Someone clutching their chest in agony, gasping for air, or collapsing suddenly. While these are certainly real warning signs, the truth is that heart damage does not always announce itself with a loud shout. More often, it speaks in a whisper. Some of the earliest and most critical signs of cardiovascular trouble are so subtle that they are frequently overlooked or dismissed as common signs of aging, stress, or minor fatigue. There is a common misconception that heart disease is only a concern for older adults or those with visibly unhealthy lifestyles. This is a dangerous myth. Even if you feel relatively fine, your heart could be under silent attack right now. Factors like chronic, low-level inflammation, high stress levels, and even poor dental hygiene can quietly erode the health of your arteries and heart muscle. The most alarming reality is that by the time traditional symptoms like severe chest pain appear, the underlying damage to the cardiovascular system may already be advanced. This is why understanding the silent language of your heart is so important. Your body has unique ways of signaling that the blood flow to your vital organs is being restricted. In this series, we are going to explore 11 unusual signs that your heart might be in trouble. Symptoms that occur far away from the chest, such as in your legs, your mouth, or even on the surface of your skin. Recognizing these surprising symptoms early can be the definitive factor in catching a heart issue while it is still manageable. Whether it is a strange cramp in your calf or a lingering change in your voice, these signals are your body's way of asking for help. By the end of this series, you will be armed with the knowledge to look past the obvious and protect your most vital organ before a crisis occurs. We begin our journey by looking at the surprising connection between your lower limbs and your heart health. The first unusual sign of heart trouble begins in your legs, specifically through calf swelling or pain. Have you ever noticed your calves feeling unusually sore, cramping up, or swelling after a simple walk or climbing a flight of stairs? Most people dismiss this as dehydration, a pulled muscle, or simply a sign of getting older. However, this discomfort could be a symptom of peripheral artery disease, commonly known as PAD. This condition occurs when the arteries that carry blood to your legs become narrowed or blocked by plaque buildup. When blood flow is restricted, your leg muscles are starved of oxygen, leading to pain and swelling. While this may seem like a localized circulation issue, it is a major red flag for your heart. PAD is strongly linked to heart disease and stroke because if the arteries in your legs are clogged, there is a high probability that the arteries leading to your heart are in a similar condition. Ignoring leg pain could eventually lead to more severe consequences, including heart attacks or even limb loss. The second surprising indicator is found in your mouth: bleeding gums and gum disease. It might seem strange to link your toothbrushing habits to your heart, but your gum health is a direct window into your cardiovascular system. Gum disease, or periodontitis, is a chronic inflammatory condition. When your gums bleed, it creates an entry point for bacteria to enter your bloodstream. Once inside, these bacteria can travel to your heart and contribute to the buildup of fatty plaques in your arteries. Research consistently shows that individuals with poor oral health are at a significantly higher risk for heart disease. Inflammation is the common enemy here. It fuels both gum disease and the hardening of your arteries. If you notice red, swollen, or bleeding gums, do not treat it as a minor dental nuisance. Your heart is listening to what your mouth is saying. The third sign involves your nighttime habits: snoring and sleep apnea. If you or your partner snore loudly, it is often treated as an annoying habit, but it can be a silent killer. Persistent snoring, especially when interrupted by pauses in breathing, is a hallmark of sleep apnea. This condition causes your airway to collapse during sleep, which drops your blood oxygen levels and forces your heart to work much harder to compensate. This cycle of oxygen deprivation creates immense stress on the heart and can lead to high blood pressure, irregular heartbeats, and even heart failure. People with sleep apnea are often tired during the day or wake up with headaches, yet many go undiagnosed. Addressing sleep issues is not just about getting better rest. It is about relieving the nightly pressure on your heart muscle. The fourth unusual sign is sudden, extreme weakness. We all experience fatigue after a long day or a poor night's sleep, but this is different. This is an overwhelming, intense exhaustion that appears out of nowhere and makes even the simplest tasks, like folding laundry or walking to the mailbox, feel like an impossible feat. When your heart is struggling to pump blood effectively, the oxygen levels in your body drop significantly. This forces your muscles and vital organs to struggle for the fuel they need to function. Many people mistake this sudden crashing feeling for being overworked or dehydrated. However, in reality, it can be a precursor to a heart attack. Unlike normal tiredness, this specific type of weakness does not improve with rest and can feel like you have suddenly hit a wall. If you experience this type of profound, unexplained exhaustion, especially alongside dizziness or nausea, it is your body's urgent signal that your heart needs immediate attention. The fifth sign is one that most people would never associate with cardiovascular health: skin rashes or unusual spots. We often think of the skin as a separate system, but it is deeply connected to your internal health. Chronic inflammatory skin conditions, such as psoriasis or eczema, have been linked to an increased risk of heart disease. These conditions are driven by systemic inflammation, the same process that causes atherosclerosis, or the hardening and narrowing of your arteries. People with persistent psoriasis, for example, are in a constant state of internal inflammation, which can damage the blood vessels over time. If you have red patches, scaly skin, or stubborn rashes that do not respond to typical treatments, it might be an indicator of an underlying cardiovascular issue. Managing the inflammation on your skin is important, but it is equally vital to ensure that same inflammation isn't quietly damaging your heart. Our sixth sign is unexplained nausea or indigestion. This is a particularly tricky symptom because it is so easy to blame on a bad meal or acid reflux. However, when the heart is failing to circulate blood properly, it can affect the digestive system, leading to feelings of bloating, stomach pain, or persistent nausea. This is especially common in women, who often experience these gastrointestinal symptoms as primary warning signs of a heart attack, rather than the classic chest pain. If you find yourself feeling sick to your stomach without a clear cause, especially if it is accompanied by shortness of breath or discomfort in your jaw or back, do not assume it is just food poisoning. Your digestive tract might be reacting to a heart that is struggling to maintain its rhythm. Trusting your instincts in these moments is essential. It is always better to have a doctor confirm it is just indigestion than to ignore a potential cardiac event. The seventh sign on our list is a persistent hoarseness or a chronic cough. Most of us attribute a lingering cough to seasonal allergies, a common cold, or perhaps acid reflux. However, if you have a dry, hacking cough that simply won't go away, your heart might be the true culprit. When the heart's left side weakens, it cannot pump blood out to the body effectively, causing blood to back up into the veins that take blood from the lungs to the heart. This pressure causes fluid to leak into the air sacs of the lungs, a condition known as congestive heart failure. This fluid irritation leads to a persistent cough or a wheezing sound. A key indicator of a heart-related cough is that it often worsens when you lie down at night and may produce a pinkish or white phlegm. If your cold has lasted for weeks and is accompanied by swelling your ankles or fatigue, it is time to look beyond your lungs and check your heart. The eighth sign is perhaps the most alarming: fainting spells, also known as syncope. Fainting occurs when your brain experiences a sudden, temporary drop in blood flow, leading to a loss of consciousness. While it can sometimes be caused by standing up too fast or being dehydrated, unexplained fainting is never something to ignore. Your brain requires a constant, high-pressure supply of oxygenated blood. If your heart rhythm becomes irregular, either beating too fast or too slow, or if a heart valve is narrowed and blocking blood flow, the brain is the first organ to feel the deficit. If you feel sudden lightheadedness, see spots, or lose consciousness without a clear trigger, it could signal an underlying arrhythmia or valve disease. These short circuits in your heart's electrical system can be life-threatening if left unmonitored. The ninth sign is sudden or excessive sweating, specifically what many call a cold sweat. We all sweat during exercise or on a hot day, but breaking into a profuse sweat while sitting in a cool room is a major red flag. When the heart is in distress, the body's sympathetic nervous system, the fight-or-flight mechanism, is activated. This release of adrenaline causes your heart rate to spike and your sweat glands to overproduce. Many heart attack survivors describe a sudden, clammy sensation that feels like they've been drenched in cold water, often occurring alongside chest pressure or nausea. This is not a hot flash or a fever. It is your body's emergency alarm. If you find yourself sweating excessively for no logical reason, do not wait to see if it stops. Your heart may be struggling to maintain its function, and every minute of delay increases the risk of permanent damage. The 10th sign is unusual or prolonged anxiety. While we typically view anxiety as a mental health issue, your heart and nervous system are inextricably linked. When your heart struggles with an irregular rhythm or poor circulation, it can trigger a physical sense of doom or intense panic. Many people, particularly women, report feeling a sudden wave of overwhelming anxiety or a racing heart as an early warning sign of a heart attack, rather than the classic chest pain. If you experience panic-like symptoms such as a pounding heart, dizziness, or shortness of breath that feel different from regular stress, do not dismiss them as being all in your head. Your body may be using your nervous system to send an urgent distress signal about your cardiovascular health. The 11th and final sign is a decreased tolerance for exercise. This is often the most overlooked symptom because we tend to blame it on getting out of shape or getting older. However, if activities that used to be effortless, like climbing a single flight of stairs or walking the dog, now leave you winded, exhausted, or dizzy, your heart may be struggling to keep up with the demand for oxygen. A sudden or progressive decline in your physical stamina is not just a sign of age. It can be a primary indicator of heart failure or blocked arteries. Your heart is a muscle, and if it cannot perform during exertion, it is telling you that its reserves are dangerously low. Understanding these 11 signs is the first step, but the most important step is what you do with this information. Protection starts with lifestyle modification. Focus on a heart-healthy diet rich in omega-3 fatty acids, fiber, and lean proteins while drastically reducing processed sugars and trans fats. Physical activity is equally vital. Aim for at least 150 minutes of moderate exercise each week to keep your arteries flexible and your heart muscle strong. If you smoke, quitting is the single most impactful change you can make to lower your risk almost immediately. Finally, do not wait for symptoms to appear before seeing a professional. Regular heart checkups, including blood pressure and cholesterol screenings, can detect silent issues before they become emergencies. Your heart works tirelessly every second of your life. It deserves your attention and care. By listening to these unusual signs and taking proactive steps today, you are not just preventing disease, you are ensuring a longer, more vibrant life. Remember, when it comes to your heart, prevention is always more effective than a cure. Listen to your body, trust your instincts, and prioritize your health.